Imagine for a moment you open your mailbox. Tucked between the usual junk mail and bills is a plain white envelope from a government agency. Your hands feel a little cold as you open it. Inside, a letter filled with dense, bureaucratic language boils down to one terrifying, life-altering message. In a matter of weeks, the health insurance that stands between you and potential ruin is going to vanish. There's no appeal process, no alternative path offered, just a hard, unmovable deadline. After that, you are on your own. For hundreds of thousands of people across the United States, this is not a hypothetical nightmare. This is the reality they are facing right now. As of August 31st, a sudden and decisive policy change is set to strip health coverage from a group of people known as Dreamers, the recipients of the Deferred Action for Childhood Arrivals program, or DACA. This single move has detonated a political bomb, throwing the principles of public health into a brutal cage match with a fierce, ongoing debate over immigration, national identity, and taxpayer money. But beneath the thunder of political rhetoric and the glare of news headlines, there are real individual lives hanging in the precipice of a future where a sudden fever, a broken bone, or a chronic illness could spiral into a devastating personal and financial catastrophe. So, how did this happen? How can a safety net for so many be pulled away so suddenly? The answer lies not in a new law debated and passed by Congress, but in the quiet, almost invisible stroke of a pen deep within a government agency. The Trump administration revisited and decisively reversed a Biden-era rule by fundamentally changing the official definition of who is considered lawfully present for the purpose of health care eligibility. This might sound like a minor tweak in bureaucratic jargon, but in reality, it was like changing the lock on a door that thousands relied on to access a fundamental need. This administrative maneuver effectively pulled the rug out from under a system that had allowed DACA recipients to purchase subsidized health plans through state-run marketplaces like Covered California. The Centers for Medicare and Medicaid Services, the agency behind the change, defended the move with a clear, concise, and politically potent justification: it will save taxpayers money. But health advocates across the nation are sounding a five-alarm fire, warning that this seemingly prudent financial decision is a ticking time bomb. They argue it as a short-sighted move that will not only devastate a vulnerable population but will eventually boomerang back, creating a far more expensive crisis for the very health care system and the very taxpayers it claims to be protecting. To truly grasp the immense weight of this decision, you have to look past the political labels and understand who these dreamers really are. The term DACA recipient can sound clinical, a sterile category in an immigration file. But it represents hundreds of thousands of unique, deeply American stories. These are individuals who were brought to the United States as young children, some so young they were tucked into the back of a family car with no memory of the journey or the country they left behind. They didn't make a conscious choice to cross a border. That life-altering choice was made for them. They grew up in American neighborhoods. They learned the Pledge of Allegiance in American classrooms. They went to American proms, got their first driver's licenses, and worked their first jobs flipping burgers or stocking shelves. They are woven into the very fabric of American society. They work as nurses and teachers, as engineers and construction workers, as small business owners who create jobs for others. They pay billions of dollars in federal, state, and local taxes every year. They are, in every cultural and practical sense, American. Yet, they exist in a painful paradox. They live in a state of legal limbo, protected from deportation for now, but with no formal status and no clear path to the citizenship that would grant them permanent security. This policy change doesn't just threaten their physical health. It is a brutal reminder of their precarity, reinforcing the message that in the only country they call home, they are perpetually on thin ice. For the approximately 2,400 DACA recipients in California and the over 500,000 nationwide now facing this deadline, August 31st is the start of a period of impossible choices. Let's translate this from policy to people. Picture a 24-year-old college student with type 1 diabetes, whose very life depends on a monthly supply of insulin that can cost hundreds, even thousands of dollars without insurance. Now, she must choose between her life-sustaining medication and her tuition. Picture a 35-year-old roofer with asthma who relies on an inhaler to prevent a potentially fatal attack on a hot, dusty job site. Now, he must choose between the medicine that lets him breathe and putting food on the table for his family. If one of them gets into a car accident or is struck with a sudden case of appendicitis on September 1st, they will be rushed to an emergency room and will walk out with a bill so large it could financially cripple them for decades. While they can technically still purchase private insurance, the cost without the Affordable Care Act subsidies is astronomically high, often more than their monthly rent, making it a cruel illusion of an option. They are being systematically pushed into the shadows of the healthcare system, forced to ration medication, delay crucial doctor's visits, and live in a constant state of quiet terror, praying that they don't get sick. But health advocates are shouting from the rooftops that this crisis will not be contained. It's a contagion of consequence with a dangerous ripple effect that will inevitably touch everyone. Christine Smith, a policy advocate with Health Access California, explains that when people lose access to affordable, preventive care, things like routine checkups, cancer screenings, and managing chronic conditions, they don't simply stop being sick. Their problems get worse. A manageable condition becomes a full-blown crisis. And when that crisis hits, they will have no choice but to go to the one place that, by federal law, cannot turn them away, the emergency room. This triggers a devastating domino effect. First, emergency rooms become overwhelmed, leading to longer, more agonizing wait times for everyone, including the tax-paying citizens the policy was meant to protect. Second, hospitals are forced to absorb billions of dollars in uncompensated care for treating uninsured patients who cannot pay their bills. These massive costs don't just vanish into thin air. Hospitals are businesses. They pass those costs on to everyone else in the form of higher prices for procedures, inflated facility fees, and, most critically, higher insurance premiums for every other person and every other company. The policy designed to save taxpayer money is, in effect, a slow-motion transfer of costs, making the entire system more expensive and less efficient for all. It is like ignoring a small leak in the roof until the entire ceiling collapses and then handing the massive repair bill to the neighbors. However, to ignore the other side of this fiery debate would be to miss the full story. On online forums, in community meetings, and around dinner tables, a very different and equally passionate narrative is unfolding. For millions of American citizens, this issue is not about public health statistics. It's about a raw and visceral sense of fairness. The sentiment is repeated like a mantra: I am a working, tax-paying American, and I can't even afford my own health insurance. My deductible is so high I'm afraid to go to the doctor. Why should my hard-earned money go to pay for theirs? This is not just an abstract political stance. It is a deeply personal cry of anguish from people who feel forgotten and betrayed by the very system they support. They are the small business owners whose insurance premiums are crippling their ability to grow. They are the young families on high-deductible plans that are effectively insurance in name only. They are the veterans who wait months for a VA appointment. When they see non-citizens receiving subsidized benefits, it feels like a slap in the face. Their anger is a legitimate symptom of a profoundly broken American healthcare system, one that often penalizes working people and leaves millions feeling like they are playing a rigged game. Ultimately, this healthcare rule change is just one skirmish in a much larger, decades-long war over the soul of America. The DACA program itself has always been a political construct built on sand. It was created by an executive order from President Obama precisely because Congress was paralyzed, unable and unwilling to pass any meaningful immigration reform. This means its very existence and the fates of the hundreds of thousands it protects. is tied to the volatile whims of whoever occupies the White House. For more than a decade, Congress has failed to act, leaving dreamers as political footballs punted back and forth in a brutal game. Their stories are used in campaign ads, their plight debated by pundits on cable news, all while they are denied any real voice in the process that will determine their future. So, as the August 31st deadline arrives, we are left with a tragic collision of two powerful American stories. On one side, the story of thousands of young people raised in the image of the American dream who are about to be cast into a terrifying healthcare abyss. On the other, the story of millions of citizens burdened and broken by their own healthcare struggles who see this as a necessary, if painful, correction. It is a policy designed to save money that experts warn will create a public health crisis and drive up costs for everyone. In a debate this bitter, where human lives are pitted against deeply held principles, there are no easy answers. It forces us to confront a profound and unsettling question: when a system forces its people to fight each other over scraps of security, who really wins?